So the subject of vaccines and the CDC and how much people trust the CDC. Where do things stand on that front?
Yeah, RFK Jr. and the CDC have absolutely destroyed their reputation when it comes to vaccines. What are we talking about here? Okay, trust CDC for vaccine information. During the Biden administration, look at that. It was 63%, a majority, yes. Then 59% by April of 2025, 57, 50 by September. And now look at this. Less than 50% of Americans, just 47% of Americans trust the CDC, for goodness sake. When it comes to vaccine information, the majority do not trust the CDC. And what you're seeing, in fact, is a majority of states are not actually following, or at least some of the CDC's child vaccine schedule. My goodness gracious. It takes a lifetime to build a reputation, and apparently it takes only a year to destroy it.
One thing I will note, I imagine if you go back, it was even higher. This is actually after the post-pandemic drop. This is a new drop.
This is a new low, and it has all happened under RFK Jr.
So it's after the pandemic drop. So how do people feel about vaccines and the CDC by party?
Okay, so I think this is really important on what is going on here, okay? Which is, not surprisingly, look at this. Democrats have seen a tremendous drop under this CDC, right? You go from 88% in 2023 to just 55% now. But here's what is so important. It's not just that the Democrats have dropped. It's that despite a Republican administration, Republicans have not seen much of a rise in their trust in the CDC for vaccine information. It was 40% under the Biden CDC, and now it's just 43%. So what you've seen is you've given away all that Democratic trust and built in no real new Republicans who are trusting the CDC. It is a massive shift in public opinion, and one that has really hurt the CDC's credibility under RFK.
So another way of looking at this, if you kind of reverse the perspective here, who do people trust on vaccines?
Who do people trust on vaccines? They trust Democrats on vaccines. That's who they trust on vaccines. Democrats would absolutely love, pretty pleased with a cherry on top for this midterm to be about vaccines. Party trusted more on vaccines. Look at this. Among all voters, it's plus 16. Plus 16 points among all voters, according to the latest Fox News poll. Look at this. Among independents, look, hello, a 32-point advantage. A 32-point advantage to which party is more trusted on vaccines. They don't trust Republicans. They don't trust the CDC. Who they do trust is Democrats. And that is a massive problem for Republicans if RFK Jr. is out in the public coming into this midterm election.
We could do a week just covering independents, because on almost every issue, the numbers are looking more and more like this at this point.
We are seeing now some of President Trump's midterm strategy rolling out. The White House deciding now a centerpiece of their pitch to voters is going to be health care. Trump promising a full overhaul of health care in America, looking for Congress to pull it off, though there's little appetite there to take it on. And remember, Republicans have struggled for more than a decade now to do this very thing. But still, here is President Trump's pitch just yesterday in Georgia.
I said, we shouldn't pay the insurance companies anymore. We should pay the trillions of dollars directly to the people and let the people buy their own health care. Put it in a health care account, and people loved it, and we're looking at it. The problem is the Democrats are totally bought off and taken care of by the insurance companies, so they don't want to do it.
So big question of what changes he's actually going to pull off there. But one place that President Trump has already made big changes when it comes to health care is his Health and Human Services Department and Robert Kennedy Jr.'s personal overhaul of that. The latest there is a key CDC vaccine advisory committee was set to meet next week to reconsider vaccine guidelines. That was just postponed. No new date set. And an HHS spokesperson only saying, quote, further information will be shared as available. Joining me right now to discuss is former acting CDC director, Dr. Richard Besser. It's good to see you, Dr. Besser. Thanks for being in here, coming back on. A reminder, just obviously you know, but to our viewers on what we're talking about with this committee, ACIP, that since the 60s, U.S. vaccine recommendations have first gone through this committee of independent advisors. It's historically a critical step when it comes to any vaccine changes, approvals in America. Several medical associations now are suing the administration to reverse recent changes that HHS has made and that to the childhood vaccine guidelines, and your organization is supporting that. When it was announced, you called it your worst nightmare. Have you seen an impact of that rollback on vaccine guidelines, or is it too soon to tell?
Kate, it is not too soon to tell. Across the country right now, we are seeing numbers of cases of measles like we have not seen for the past 30 years. South Carolina right now is the hotbed. Earlier, it was Texas. I expect that we're going to see measles continue to spread. And while you don't see measles on that list of vaccines that are no longer recommended for all children, what you are hearing from this committee and from our Secretary of Health is misinformation that is causing fear and doubt among so many parents about the safety and effectiveness of vaccines. I practiced pediatrics for more than 30 years. And every time I would be giving a child a vaccine, it involved a conversation with a parent around, why are we giving this vaccine? Is it safe? What kind of side effects? What's the reason for doing this? Does my child really need it? And as soon as you put in there this sense that, well, vaccines are really all about personal choice, and you can talk to your doctor and decide what you want to do, that's really confusing for people who aren't deep into this. And what we're seeing is that the rates of vaccination for measles are falling. And with that, it's the most contagious virus that we deal with. It's the first one where you're going to see a problem, and we are seeing that problem across the country.
And with this committee and with this meeting specifically, let us just assume they do get it back on the schedule whenever it does. What do you think is going to come next from them? Where do you think this is going, as this committee all of these members on this committee have been handpicked by the Health and Human Services Secretary?
Yeah, I heard an interview with the head of the committee, Dr. Milhown, and his perspective is that vaccines should all be about personal choice. And yes, parents have a role to play and have the final decision as to whether a child gets a vaccine, but it's the responsibility of the CDC to make recommendations. I looked to the CDC when I was a practicing pediatrician to tell me what's the best thing that I should be doing for my patients. What I'm saying now is you can no longer look to the CDC for this information. You have to look to the American Academy of Pediatrics. I'm a member of that organization, and other medical societies who are looking at the evidence, putting it forward. But what I think the long game is that this committee wants there to no longer be vaccine requirements for children going to school. And as a parent, as a member of a community, to me, that's absolutely frightening, because I wouldn't want to send my child to a classroom where they might be sitting next to children who are unvaccinated and potentially get a disease that is preventable. There are children for whom the vaccine doesn't provide protection. No vaccine's 100%. There are children with medical conditions where the vaccine doesn't work, where they can't get it. And part of being in a community is doing things for each other as well as for ourselves. And that, I think, is the long game. Instilling fear and mistrust in vaccines. They say they're all about safety and not about effectiveness as well. Vaccines go through so many trials to look at safety, and it's important that people have that information. But parents need to know why vaccines are being given and how it can protect their families.
Dr. Richard Besser, thank you for coming in this morning.